Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt. Today's video is another episode in the series What is CFT? And we'll be exploring how to construct a CFT case formulation. It's just designed to provide a snapshot. And so if you would like more information, go to Russell Coltz's CFT Made Simple, Chapter 13, where he includes a great description of case formulation, as well as some reproducible worksheets. So what's a CFT case formulation all about? The CFT case formulation aims to develop a shared understanding between the CFT therapist and the person they're working with of the origins of what they're going through now, and the factors that might be maintaining their concerns and difficulties. The idea is that this helps guide the CFT treatment plan, but also the case formulation really represents the first opportunity to de-blame and de-shame the person. Sometimes this can be a truly powerful and spine-tingling moment where the person recognises that actually it's not their fault, and at the same time they start to see a pathway to change. The CFT case formulation begins with exploring historical influences. The CFT therapist and the person that they're working with begin to understand the role of early emotional and relational experiences and memories of these early life experiences and the way those experiences are held as emotional memories. Of particular importance are memories of warmth and safeness versus memories of threat, trauma, and shame. For example, what was the person's experience of parents or caregivers, broader family members, authority figures and peers? Were there people with whom they felt close, connected, valued and safe? Or were important people in their life aloof, neglectful, critical or shaming? Or perhaps they experienced mistreatment or abuse. The experiences and the associated emotional memories can influence how the person sees themselves, their worth and value, and how they see others, and whether they feel safe and secure or otherwise in their relationships. From there, the CFT formulation identifies how these historical influences, in terms of significant early life experiences and learning history, lead to key fears. These fears often persist throughout one's life and are commonly related to themes of social threat. External fears relate to how the person believes others might view them, as judging, devaluing, hurting, or rejecting them. Internal fears are more about how the person judges and devalues themselves, seeing themselves as a fraud or failure, unlovable or unworthy. These key fears are very painful and can cause a lot of suffering. Fear, vulnerability, isolation and shame. And so people, quite understandably, often make desperate attempts to reduce their distress through various safety strategies and defensive behaviours. And how might someone reduce distress? Often through attempts to avoid and minimise the threat. We might avoid failure through perfectionism, or we might avoid rejection through staying away from others. Or we might avoid the pain of others devaluing us by trying to appease them, or getting in first by devaluing ourselves, or perhaps devaluing them first and getting angry or lashing out. There are lots of examples, and in the CFT formulation, the CFT therapist and the person they're working with gently explore what it might be that they're doing to cope with their pain. Unfortunately, safety strategies and defensive behaviours can have very difficult unintended consequences that maintain the person's concerns, difficulties or problems, and sometimes make those problems worse. Given safety strategies can often revolve around avoidance, the consequences can be greater isolation and less connection and care from others. Relationships with others at home or work or out and about can become more difficult. And internally, the person might feel increasingly alone, lonely, unsupported, and unloved, leading to more anxiety, stress, and depression. Finally, these unintended consequences contribute to how the person relates to others and how they relate to themselves. They might see others as cold, aloof, or uncaring, or as rejecting or hurtful, or threatening in one way or another. And they might see themselves as overwhelmed, inadequate, broken, or ashamed. Sometimes people relate to themselves in very self-hating, self-critical ways and with deeply felt feelings of shame. Tragically, all people have to fall back on is their long-standing safety strategies, which then loop back to more unintended consequences and even more difficulties relating to others and relating to themselves. It can feel like a terrible trap or vicious cycle. But here's the good news. All of this makes complete sense and gives us some important clues as to what to do next. We have tricky brains and we can't help but be shaped by our experiences. It's not our fault. In fact, the CFT case formulation represents the person doing their absolute best to survive in the circumstances that their life presented to them. From here, we can develop mind awareness and understanding and use some very practical strategies to intervene at different points in the formulation. Body-based practices, imagery practices, new ways of thinking and reasoning, cultivating feelings of warmth and safeness, and a whole new repertoire of helpful behaviours. And so we begin our compassionate journey.